Greetings from Trinidad and Tobago. My name is Paul Taylor, and I'm presenting on identifying the strategic management issues that impact preventative and corrective medical equipment maintenance practices at the Eric Williams Medical Sciences Complex. The Eric Williams Medical Sciences Complex was constructed in the 1980s. The initial intent was to establish a tertiary level teaching facility. The complex consists of 5 hospitals: adults, pediatric, women's, dentistry, and veterinary. Initially, it was set up as a standalone health facility with services accessed through a fee-for-service system. However, when there was wider health sector reform, it was incorporated under the Central Regional Health Authority. Later, it was merged with the Northwest Regional Health Authority, and then later separated again to become the North Central Regional Health Authority. Now, all RHAs have a huge assortment of physical assets, buildings, hospitals, health centers vested in them, worth hundreds of millions of dollars. However, there are no mandatory provisions for maintenance management professionals or practitioners to sit on the boards. This creates a significant gap at a crucial strategic level in an important area of expertise. The manifestation of this gap is easily recognizable in the many challenges all RHAs face with the maintenance of plant and equipment. There are many disruptions to the delivery of patient care services due to maintenance-related failures. Maintenance is generally considered a necessary expense, though reluctantly funded and resourced. In times of cost-cutting or budgetary realignment, it is one of the first expense items to be on the list of cost reduction measures. However, since medical equipment availability and reliability have become critical issues in the technologically intensive healthcare environment, the strategic importance of maintenance must be acknowledged. There are medical equipment maintenance challenges impacting the effective delivery of healthcare at the Eric Williams Medical Sciences Complex. These manifest themselves in extended downtimes on key items of medical equipment, resulting in either cessation of patient care or delay of care due to the reduced access to diagnostic, therapeutic, and monitoring medical equipment. These problems are viewed by management only from an operational perspective. These problems, however, have strategic dimensions and cannot just be solved at the operational level. Therefore, there's a lack of understanding by senior management of the strategic management issues that impact preventative and corrective medical equipment maintenance practices and the subsequent outcomes at the Eric Williams Medical Sciences Complex. So the study was done, and the goals of the study were to establish a bridge of understanding between middle-level maintenance management and top-level executive management on the issues affecting maintenance. Secondly, to identify the strategic management issues impacting medical equipment, corrective and preventive maintenance practices at the Eric Williams Medical Sciences Complex. And to provide, thirdly, recommendations to strengthen the medical equipment maintenance practices at the institution. In undertaking the study, there needed to be a theoretical framework in which to anchor the information. And so the system theory was used as the anchor for the study. And by system theory, I refer to a system is a network of interdependent components that work together to try to accomplish the aim of the system. Systems theory focuses on the arrangement of and the relations among the parts and how they work together as a whole. The way the parts are organized and how they interact with each other determines the properties of that system. The system is typically unified and purposeful, consisting of interconnected, interacting, and interdependent parts. The three conditions that must be satisfied are: one, the behavior of each element has an effect on the behavior of the whole. Two, the behavior of the elements and their effects on the whole are interdependent. And thirdly, subgroups of the elements are formed, each having an effect on the behavior of the whole and none having an independent effect on it. Therefore, in order to discuss any component or subsystem, one must first review the entire system. And that was the theoretical framework for the study. The methodology, we gathered primary data. The primary data consisted of face-to-face interviews with key stakeholders within the maintenance department and outside, but within the organization. And the secondary data involved the review of documents, the North Central Regional Health Authority strategic plan, the business plan, and the annual reports. All of that information was gathered and analyzed. For the face-to-face interviews, a thematic analysis was undertaken to connect ideas or recurring themes. The review of the secondary data was done to collaborate the information that was received through the face-to-face interviews. And then, of course, analysis and explanation patterns emerge with specific themes. From those themes, there would have been an analysis that led to conclusions and in turn led to recommendations. What were these emerging themes that were identified? One, strategic issues in relation to staffing and staff development issues. Two, lack of spare parts and its associated issues related to procurement and the procurement mechanism. Thirdly, C, performance, the actual performance and execution of corrective and preventative and corrective maintenance. And fourthly, the dichotomy that developed between balancing outsourcing and in-house, working to establish the right balance. And certainly during the study, it was observed that that balance had not yet been reached. So the recommendations were these. Firstly, to modify the terms of extended warranties that were engaged with private sector and manufacturer providers. Secondly, to address the staffing and staffing issues, to create a leadership stream, very much like how the military will have an officer stream for the service. Thirdly, to develop and implement equipment lifecycle planning budgetary process that was lacking. So equipment procurement was largely haphazard and there was no standardized mechanism for it being done. And fourthly, to review the mixture of maintenance methods and methodologies used in the execution of maintenance. And so in conclusion, the study fulfilled its primary goal of providing an understanding of how maintenance practices were impacted by strategic management issues. It also was able to provide the connectivity between policy and practice, or the lack thereof, through the identification of actions or inactions throughout the organization. And the study also served to sensitize senior management on the challenges affecting maintenance. Thank you. I am Paul Taylor, presenting from Trinidad and Tobago.